Hello, everyone. Today we are going to our lecture, which deeply we are focusing in the individual health education. How how individual health can promote the skills and information of the people. How this have the good effective to the upgrade the awareness of the community. Yeah, this is the mainly lecture of the today. Introduction to the individual health education, definition and scope and theory foundation. The agenda of this meeting today, we are going to see the introduction to health, to individual health education, also to see the definition of individual health education and scope of individual health education, theoretical and foundation of the health education. Moreover, we can go through the importance of individual health education in the public health, rules and responsible of health educator. Additionally, the challenges in implementing individual health education. Lastly, lastly is the conclusion and take away conclusion of the health education. Now let us to go through the overview of the health education in public health. Health education in public health is the, as we mentioned in the previous lecture, is considered as the vital component that empowering the individual with knowledge and skills. Individual with knowledge and the the health education is the public health in public health is considered as a vital component that empowering individual with the knowledge and skills that necessary to improve their health outcomes and that can with encompasses in the broad range activities which aim to promote the behaviors. Additionally, the importance of individual health education for the community that is a play crucial role in the community by fostering the informing the decision making among the individual and also encourage the people or encourage the individual with a healthy behavior or healthy lifestyle which lead to reduce the disease transmission. When individuals understand how their action impact their health, they are more likely to adopt the good behavior. This is the one of the important of the hello. Yeah, this is the important of individual health education in the community. As I mentioned, is a play crucial role and also fostering the decision making among the individual that can let them to take the good decisions for their lifestyle and also for the good behavior. The purpose of this presentation, as I mentioned, fundamental and concept of the individual education and explore its scope and theoretical basis that highlight the significance with the broad field of public health. Let me to go to next slide. A definition of individual health education is a process of providing information and skill to individual. Individual health education involving delivery target information and training and supporting to tailor needs, enabling people to understand the skills and adopt the good behaviors. Yeah, this is a definition of the individual health, as I mentioned it. It is a process. It's a process that you are going to give the information to your community or to the people, like the transmission of the cholera, like stop smoking. All this is information, yeah, and skills, yeah, how you can practice good behavior skills, yeah, and skills that can promote the behavior or healthy behavior of that person. This is considered as the definition of the individual health education. Secondly, the empowering individual to
क्या
make healthy choice.
क्या
Yeah,
बता रहे?
individual health, with the individual health, with the individual
क्या?
health that can empowering the individual make the good choice. Like when you are teach the some individual or some people with the when you are teach some person about the or upgrade the information, like example when you are tell them how you can, it is important to use the clean waters, that can help them and understand this message, that can help them to do the good choice, yeah. If he found the clean water and not clean water, he's going to use the clean water because he already know the benefit of the clean water, and additionally he know the 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 impact of the or risk of the non-chlorinate or non-clean waters. Yeah, yeah. That it means when they give health individual health education, empowering the individual health choice. Yeah, when you are give them the information that can let them to take the good decision that is allied with the health behavior. Also, the focus on the personal health behavior. While broad public health strategy are, are essential, individual health education center emphasis the changing the personal behavior, such as the diet and exercise and smoking cessation and medication adherence. Recognize that the personal choice significant influence over all the health care. With the individual health educations, that means can support that person or the people to be to be to have the healthy behavior, as I mentioned here, such as when you explain someone about the healthy food and non-healthy food, and also he's and explore him the advantage of the healthy food that can let them to focus in the healthy food or healthy diet. Yeah. Additionally, also when you are explaining them the importance of the exercise in his body, that also can help them to change the good behavior. Perhaps can practice like 30 30 exercise 30 minutes per day. Additionally, also smoking session when give them the information how this smoking is affect for their health, and also can promote the cancer in the body, that also can help them to select the good behaviors. Now let us to see the scope of individual health education. In this scope includes the disease prevention and health promotion. The scope of individual health education convert cover the effort to prevent disease through the vaccination and screening and lifestyle modification, as well as the promoting overall willingness and encourage the positive habits and environmental conductive. Yeah, that means yeah, one of the scope, the individual health education is the play. It is the plays the role how can promote the vaccination behavior among the community. Can let the all children, even the women and yes, even the women can receive the vaccination. Additionally, also can promote encourage the positive habit like exercise and also use healthy food. Yeah. Moreover, lifestyle modification. This can let the person to be to select the healthy lifestyle. Yeah. This is the one scope which focusing how we can prevent the disease and upgrade our health. Yeah. This is the one scope. Yeah. Second scope is to address the lifestyle factor such as diet, as I mentioned, also exercise and promote smoking cessation. Yeah. Also, individual health education also focusing in this issue or yeah in this issue such as lifestyle and also diet, healthy diet or good diet. Moreover, exercise how we can practice the exercise on daily basis to let our body to be more fitter. Additionally, smoking such session. In this session, this can let us to upgrade the awareness of the people. Yeah. Last scope is to emphasize the both clinical and community setting. Individual health education occurs the diverse setting from the clinical encounters and the community outreach program to school and workplace, allowing to tolerate the intervention that can meet the specific population needs. Yeah, yeah. With individual health, the scope of the individual health education also emphasizing the both clinical and community setting. Individual health education occurring, as I mentioned, from the clinical level until in the community, which include community and environment, school environment program, also in work place. Let us to go through now. Let us to see the theoretical foundation of health education. There is a SAMHSA theoretical in health education, which they are focusing or boosting the individual health. One of the theory, the behavior change, which focusing in the money theory. One of them is the health belief model and theory of the planning behavior. Understanding the behavior change theory like health belief model and the theory of the planning behavior help the health educator to design the strategy that effectively motivate individual and adopt the healthy habit by addressing the belief and attitude and perceived control. He's mentioned one of the theory which is focusing in the behavior change, which calls the health belief model. The understanding the behavior change, understanding the behavior change is very important and also help us to design the programs help us to design the program that let to be more effective yeah more effective to respond the health issue in our the community. Moreover, learning theory, like adult learning theory, social learning theory such as adult learning and theory and social learning theory guide the development of the education program by emphasizing how others learn best. Yeah, in this can help us to understand the way that can that the other be more effective in the learning. Yeah. This is the call it emphasizing the other learning best and the importance of the social factor modeling and reinforcement behavior acquisition. Now let us to see the guide development of effective health education strategy. This theory framework provide the fundamental, create and tolerate the evidence-based health education intervention that are more likely to success in change individual behavior and fostering sustainable health improvement. Also, there is another guidance or guide another theory which is focusing in the guidance development effective education strategy. When we are using good strategy, that means can help us that can help us the theoretical framework provides the foundation and creates the tailored and evidence-based health intervention. When we have a good strategy that can help us in the intervention and let the program to be more effective. Now let us see the importance of individual health education in public health. The importance of individual health education in public health. One, reduce disease incidence through the informed behavior by educating individuals about risk factors and preventive measures. Individual health education significantly reduce the incident preventive disease. The importance of the individual health education in public health. One of them, reduce disease incidence through the informed behavior. As he mentioned, if the individual know about the risk factor about some disease that can lead him to follow the preventive measurement. Individual health education significantly reduce incidence of preventable disease leading to healthy people. Yeah, because when he aware that disease is a very dangerous and not good for them health and have the risk factor and affect and very dangerous for them himself, that lets them to follow the preventive measurement. When he follows the preventive measurement, that can reduce the incidence. Like such as if someone know the hepatitis B, it is transmitted by blood, contaminated blood, or some needle or less. Let me say that. Yeah, but by this year, and also know that hepatitis B it is a very dangerous disease. Yeah, when he know when he has this information that can let them to 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 follow the good behavior to avoid themselves from this disease. Yeah, this is what she is mean that. Yeah, second important of individual health education, it is consider enhance self-efficacy and personal responsibility, empowering individual empowering individual with knowledge and skills and build their confidential manage their health, fostering and sense responsibility. When the person prevention, when he know about the preventive measurement about that some disease, that can let them to be more enhanced for a self efficacy to prevent themselves, yeah. Yeah, to follow the good behavior. Because already, like example, if the outbreak take place in some area and those people or those team, they are know about the cholera or acute water diarrhea, and acute water diarrhea, when you know about it, yeah, uh, the effectiveness, or less more less let me to say that the incident or spread of this disease among these people which have the good knowledge about the cholera or acute water diarrhea, they have more efficacy or confidence because they already know transmission measurement or mode of transmission and prevention measurement. Yeah, that can let them to be more efficacy. Means the individual health education. The last point in the importance of individual health education in public health, it is a complement broad public health initiative. While the public health policy and program create the enabling environment in individual health education, ensuring that people equipped to act with the environment and make the fetal complement system effort. Yeah. That means when the people among the community they are aware and know about the healthy issue or the good healthy behavior, that also can contribute in success of the programs. Yeah, so consider as a complement the broad of the public health initiative. If we have the some initiative in among the community to be more success among those people who have good knowledge or have the good health education. This is the three important of individual health education in public health. One of them, as I mentioned, is reduce the disease incidence through the informing behavior. Secondly, enhance self-efficacy and personal responsibility. Thirdly, complement broad public health initiative. Now let us to go to role are responsible of public health educators. Here you are going to see as your public health educator, this is your responsible. One of them assists individual health need. As your public health student or let me say public health educator among your community, your role are responsible to assess the public health need. In your community, you have to assess to see what your community is need or what is the gap in your community. Public health educator evaluates the specific health need and barrier and cultural factor influence the individual to develop relevant effective education intervention. Yeah, you can assess to know about your community more, to more know about them more. That can, when you are realize or when you are find the gap or the need among your community, that can help you to the design the programs here and send them the message to upgrade them health. This is the rule or one rule and responsibility of the health educator. One to assist the individual health need. Secondly, developing tailored health education intervention. Prepare or to developing the health education intervention. How can you do the intervention to prevent yourself, your community from the health issue or health problem? They design the personal strategy and program that address the identify the need and utilize the appropriate material or resource and message deliver and can handle that issue. The third, providing ongoing support and resource. This is a rule are responsible. Yeah, this is a rule are responsible of the public health educator like you or anyone to assess the health individual needs in your community. Additionally, developing and tolerate health education intervention, and lastly, provide the ongoing support. Now, let us to see the some challenges facing us in the individual health education. One of the challenges is the cultural and language barrier. There is a different cultural belief and language can hinder the effective communication and understanding the culture sensitively. That means, yeah, to do the individual health education or to send a message for the individuals in your community or around the world, there is some challenges or some difficulties. One of them, the cultural and language barrier. Some people, it is not same language or same cultures. This is considered as a barrier because it let the communication to be more difficult. Sometimes you couldn't understand their culture or even couldn't understand his language. This is considered as the barrier. Second challenges of implementing health education. It is a misinformation and health literacy issue. Right now, the social media, there is a disinformation taking place. Sometimes people publish the rumors, like as you mentioned, or as you know, the COVID-19. It is not affected the African people more. Just it is affect in the European people or other peoples or like that. Yeah, this it is not true. Yeah, like this. Yeah, like this information is goes through the among the community through social media and Facebook, WhatsApp, and dissemination among them. This is another challenges of the individual health education. The third challenge is implementing health education. It is the resource limitation and access disparities. That means we not have enough resource, not have more money or resource that can facilitate for us to send the health message for the person on person base. Yeah, person. We not have enough resource to do that. Yeah, that means this also is considered as the challenges in implementation of field education. Here we have the three challenges: implementation, the individual health education. One of them it is the cultural and language barrier. As I mentioned, there's the different culture among the people, even the language. Some people even not know Arabic, no English, just or no Chinese, no French, like that. Yeah. But you just already know this is considered also as the language. But secondly, as I mentioned, disinformation or misinformation and literacy. Many people there, yeah, among the community you can find the many people they are ignore or literacy. Yeah. And also some rumors also take place, as I mentioned, during the COVID-19. One day, when we're hearing there is some child, he let me to say that he dreaming or he mentioned someone has to protect yourself or to prevent yourself, you have to take the cup of tea, which is a total not related even. That is considered is one of the disinformation. Also, as I mentioned, the limited resource. Yeah. We not have enough resource to send the message individually or to the many people alone personally. In the last slide, we are going to focus in the conclusion. Understanding the core, understanding all. As I mentioned, the individual health education. That means give the information and skills to someone to change their behavior or to follow the health behavior. No smoking. Like if someone smoking, give them the information. Smoking is not good, and also give them some skills. You have the quit or stop little bit, even, especially during the fasting seasons or yeah, during the suitable times. Yeah. Like skills, give them the skills. Yeah, that can help them to understand the health more. When you are understanding understanding the core concept of the health education through the gaps. Let me to say the conclusion mainly. Understanding is the core concept in individual health education that can let the people to understand through the gaps of individual health education definition and scope and theoretical. Additionally, recognize the critical role of the public health outcomes. Individuals' health education it is the cornerstone of the public health, directly influence in the disease prevention and health promotion. When you are, have the good health education, that means will be the very nice in among community to upgrade the prevention or promote the health among the community. Lastly, encourage future public health professionals to prioritize the personalized education strategy. Future public health professionals should prioritize personalized, cultural sensitive, and evidence based education intervention to maximize the impact. Yeah. Thank you. This is the last slide for our lecture. Now